If you have had an operation on a joint, let's say a shoulder or a knee, committing to a lifelong rehabilitation program is critically important for you to get the best possible outcome. Let me share with you why. So I'm going to talk about two operations today. One's called a labral repair. That's basically the disc in the shoulder, the cartilaginous disc that helps stabilize the shoulder and keep it in place. And an ACL repair in the knee. That's a ligament that is critically important for maintaining stability and preventing dislocation. So if you need a labral repair or an ACL repair, there are a couple of things that you're going to face postoperatively that you really need to commit to overcoming for the rest of your life. The first thing is reestablishing full range of motion. When the surgeon goes in there and repairs that labrum or ACL, there is a ton of inflammation and injury that happens during the surgery. And as a result, that inflammation is sitting in the joint and tends to cause stiffness and pain. And if you don't work through that and you get something called a frozen shoulder or a knee that you can't fully extend or bend, that is a catastrophic outcome. And once that scar tissue sets up, it's extremely difficult to undo. You can undergo a surgical procedure called a manipulation under anesthesia, but I can tell you from personal experience after treating these patients, it's definitely a suboptimal outcome, and you really need to commit to getting the full range of motion back. That range of motion is not only going to be functionally best for you, but it's also going to increase the amount of synovial fluid that's flowing in the joint, and that is what feeds the joint. Cartilage is an avascular structure. It gets nourishment from the synovial fluid, critically important to reestablish your full range of motion. The next is building strength. The joint is supported by internal structures as well as external structures, and those external structures is the strength around the joint. It's the muscles of the rotator cuff, it's the muscles like the hamstrings and the quad, and those things fire in a way that supports that joint, gives it stability and strength, and helps prevent any wear and tear on that repair that you've already had. The next one is reestablishing coordination and stability of the joint. In addition to strength, there's very small receptors called proprioceptors, which indicate where the joint is in space, and those are injured and blunted as a result of surgery, and you want to reestablish that with your therapist so that the joint is coordinated and has no more laxity in it. And finally, you want to reduce pain and swelling. If you don't work on range of motion, strength, and stability, you're going to have continued pain and swelling, and you're going to get in a vicious cycle of lack of rehab. Now, both of these operations, the ACL and the labral repair, typically takes a full year before you're really back to feeling 100%. And I would encourage you to continue to do your therapy after that time frame, after the year, because it's going to maintain the health of the joint and give you your best possible outcome. I've written my latest newsletter. I've given you specifics on things that my physical therapy friends have recommended for these specific operations. If you're interested, go to Dr. ZH Fit, sign up for our newsletter, and we'll get this out to you as soon as we can.